Hi, my name is Donna Addium, and I'm here today with Susie Chestnut, Jen Rolleder, and Annette Sheets. We are doing our last case study in the BSN program on pneumonia. And we have a 65-year-old Caucasian male who returns to work following 2 weeks on a cruise ship with his wife. He's brought to the emergency room by his co-workers who report that he had been complaining of a severe headache prior to a sudden onset of confusion and tachypnea. His wife arrives at the ER and further reports that he's been experiencing flu-like symptoms, including a cough, fever, and chills. She also reports that he's been complaining of having diarrhea, nausea, vomiting, and general muscle aches since returning from the cruise. His history is he's a diabetic, he has a sedentary lifestyle, he has COPD, he eats fast food every day and is an alcoholic. He smokes 1 pack of cigarettes a day. His weight is 285 pounds. He's 5'7", and his BMI is 45.8. The patient has an excellent self-image due to extracurricular activities. His medications are metformin, Ativan, and Preventil. And now I'm going to have Susie take over.
Hi, I'm Susie Chestnut, and we're going to be discussing the flu-like symptoms. Patient presented to the emergency room with an oral temperature of 103.1, heart rate 132, blood pressure 119/59, respiratory rate of 30 in labor, oxygen saturation 77% prior to the non-rebreather mask placement. The assessment upon arrival is confusion, headache, elevated respirations, gastrointestinal symptoms, cough and sore throat, as well as weakness and chest pain. Nursing interventions are as follows: place patient on the cardiac monitor, apply oxygen with a non-rebreather, placing 2 large bore IVs, administering normal saline, keeping IV access open for labs. Place patient also in a 90-degree position. Questions for stage 1 is, could Leon have acquired pneumonia on the cruise ship? And if so, where on the cruise ship would he most likely be exposed? Question 2 on stage 1 is, should the patient be admitted into critical care, or should he be sent home on a medication regimen based on the signs and symptoms presented? Answers would be the whirlpool for question 1, and question 2, based on the signs and symptoms presented in the emergency room, Leon requires admission to correct his respiratory deficiency as well as the acute infection. Jen Rolleder is going to come talk about stage 2.
Are we ready? Hi, I'm Jen Rolleder, and I'm going to be talking to you about stage 2 of our patient. So stage 2 is the onset of the pneumonia. The patient reports feeling this imminent doom and deep depression. We're going to go ahead and do an assessment here. We're going to get the CBC, a Chem 7, a Chem 12, an ESR, and we're going to get some blood cultures. We're also going to have him do a urine analysis in a cup, and we're going to do a urine culture. We're going to do an x-ray, chest, PA, and lateral. So that's frontal and side. And then we're going to do a CT scan on him, on his head, to find out if he has any deficiencies there. We're going to have respiratory come in and do an ABG, which is an arterial blood gas, and that tells how much oxygen he is getting and or maybe not getting. We're also going to add an additional 2 large bore IVs. And then we're going to do some stool culture since he's talking about having diarrhea. We're going to, as nursing interventions, we're going to do, draw those labs. We're going to collaborate with the healthcare team and with him. And the healthcare team is the respiratory therapist, the doctor, the radiologist, and we're going to talk to any other healthcare team that gets involved with the patient's care. And we're going to provide ongoing education as we progress through this stage. We're going to evaluate the labs, and we're going to collaborate again with the physician and anybody else that is part of the care of this patient. Then we're gonna ask you some questions. So the questions are: 1, what are the immediate nursing interventions to help assist the patient while he awaits the test results? Question 2, what support system are we integrating during this phase? Here's some answers that we thought you might want to look at. Ask the patient what his pain level is, because we don't know. And then help the patient reposition, because maybe the pain isn't so much in a certain position and we might have to not give him medication and just distraction and rest. Update the patient and family on the vitals and progression of the testing and how it's coming back from the labs and the CT. Continue monitoring the patient's stats on the monitor that's next to him or behind him in the bed area that he's in. Ask the patient about what his cultural beliefs are, and also what his health beliefs are, because he does have extracurricular activities that he was saying before. Ask if the patient desires to have all of this integrated into his healthcare plan while he's with us today. Ask the patient, what is his support system at home with his family? Does he have children? Who's there to help take care of him if he goes home? And then we're also going to do stage 3. We've got an onset of pneumonia here that comes back. His temperature is now increased. It's 105. His blood pressure is 80/40. His pulse is 128. And his O2 sats for saturations for him is at 100%. But you also know he's on the non-rebreather. Think about that. Our nursing interventions are going to be place a cooling cap on the patient's head because we need to decrease that fever. We're going to administer some antibiotic therapies such as Flagyl 500 and Ansef 3 grams. And that goes weight kilograms. By kilograms is Ansef. We're also going to monitor his urinary output as he progresses with how much fluid we're putting in and how much fluid is coming out. We also have something where it's evidence-based practice. We wanted to talk to you about that because that's really important in our program. Is with this onset of pneumonia, the use of antibiotic therapy such as that Flagyl and then the Ansef that we spoke about, the Ansef based on the kilograms for the treatment of community-acquired pneumonia, it requires critical care. So we're going to admit him in quickly. A patient who's receiving this antibiotic therapy like Leon's, within the 3-month period, he needs to be followed up. He has a lot of risk factors going on with that diabetes mellitus, and it should be treated constantly until he clears from his labs with antibiotic therapies. And we'll probably put a PICC line in, and that's another IV placement that we do. Here's our questions for stage 2. What type of pneumonia has Leon acquired? Question 2. What is the pathophysiology of this pneumonia? Here's the answers. Leon has developed a community-acquired pneumonia known as Legionnaires. It is a gram-negative bacteria that thrives in man-made water sources. This includes whirlpools, water fountains, air conditioning systems, and those found on cruise ships, one next to the other. Water vapors containing bacteria that have been inhaled. All right, now I'm going to turn this over to Annette Sheets, and she's going to talk to you about Legionnaires. Thank you.
Yeah, so as Jen said, this is a community-acquired pneumonia. It's caused by a gram-negative bacteria, and this bacteria may also be found in hospitals and health clinics and public parks, anywhere where there's man-made water sources. A whirlpool on a cruise ship would be a great place for a Legionnaire. So the pathophysiology of Legionnaires is that once it's inhaled, the bacteria travels to the lungs, and there it's engulfed by the immune system's macrophages and monocytes. And this explains why we first saw Leon with flu-like symptoms that slowly progress into pneumonia symptoms. Leon's history of diabetes mellitus and COPD put him at risk for contracting Legionnaires, which is not transmitted person to person. So it's not contagious. His wife and co-workers were never in any danger of getting it from Leon. And preventative measures include water sanitation and maintaining the appropriate pH levels in those whirlpools and water fountains and those things. And that concludes our contracted units inhaled from contaminated water vapor. The Legionnaires lives in water fountain whirlpools. Concludes our last presentation in the BSN program. Thank you.